hopefully everybody can see those okay. So as Dean said, I'm Research and Insight Officer, and I'm going to give an overview of the findings from our neurological health project. So for our third project for 2024, we looked at neurological health. If you would like some more information about our previous projects, please visit our websites, and I'll drop the link in the chat at the end. So we focused on conditions such as multiple sclerosis, epilepsy, Parkinson's, migraines, as well as those which have a strong neurological element, such as fibromyalgia, chronic fatigue syndrome or ME, functional neurological disorder, chronic pain, amongst many others. So why did we pick neurological conditions? Well, the Joint Strategic Needs Assessment, known as the JSNA, highlights that headaches are a key cause of years lived with disability in Lincolnshire. And also, for some neurological conditions, patients in Lincolnshire have to travel out of the county to access care, often to places such as Sheffield or Nottingham. In 2018, a group of researchers at the University of Lincoln conducted a health needs assessment on neurological conditions in Lincolnshire. And a health needs assessment is a process used to identify the health issues affecting a community, the resources available, and the gaps that need addressing to improve overall well-being and access to services. And in this work, the researchers spoke to both patients and healthcare professionals to understand kind of what it's like living and diagnosing neurological conditions in Lincolnshire. And some key headlines included that there were gaps in the diagnosis, treatment and support for neurological conditions in the county. Healthcare professionals often had a limited knowledge of conditions. And as I said, that patients often have to travel to access care, which can be difficult with the symptoms they're facing. They reviewed all of these findings and put together a series of recommendations to improve care for neurological conditions in the county. And these mainly focused on a need to improve training for professionals, coordination of care, and enhancing accessibility of services in the county. So many of these findings were echoed in the survey we conducted prior to the introduction of the integrated care system. In 2022, on behalf of NHS Lincolnshire, we were asked to talk to the public about their priorities for health and care in Lincolnshire. And part of this work, we were asked to focus on 4 neurological conditions, which were multiple sclerosis, ME or chronic fatigue syndrome, epilepsy, and fibromyalgia. And the findings of this work reiterated many of those that were found in the 2018 work, which included a lack of understanding of the conditions, long waiting times to be diagnosed, and a lack of support. So we decided to revisit neurological conditions this year to see what has changed and invite all those with all the different neurological conditions to share their experiences. So how did we gather experiences? We wanted to make sure we heard from both patients, service users and professionals to ensure we were gaining a rounded understanding of the picture. And we launched 2 surveys. They were mainly online. However, we completely recognise that not everybody can or wants to fill in a survey online. So paper copies were available on request and could be sent back to us through our free post address. We were also distributing copies out and about on the ground to local support groups and through our outreach clinics, which occur throughout the county. People could also share feedback over the phone if they would prefer. And the survey covered things from diagnosis to medication, treatment, waiting times, and what could be improved about their care, and also what works well. So who shared their views? 375 people shared their views. 374 of these were patients and 1 was a professional. This was despite us reaching out through several different channels to professionals. So what conditions did people share their views about? So 39% of all the responses related to fibromyalgia, 13% to ME or chronic fatigue syndrome, 11% to multiple sclerosis, and we also heard from a range of conditions, as you can see, such as brain injury, dementia, epilepsy, stroke, and other. Other included ADHD and autism, as well as some more rare neurological conditions. So this and the following slides presents an overview of the findings when looking at all the conditions together as a whole. I appreciate they're incredibly different, but lots of the findings from the survey really just highlighted the same issues. So we'd like to say a huge thank you to everyone who took the time to share their views. As always, the experiences shared with us are really powerful. As I kind of briefly touched on, experiences did not appear to differ based on characteristics such as age or where someone lived in Lincolnshire, or to some extent even the neurological condition. And what I mean by that is people with fibromyalgia raise many of the same issues as those with chronic fatigue or chronic pain, etc. So respondents were asked to rate elements of their care on a scale from very good to very poor, and overall the majority rated the majority of aspects of their care as poor, especially when it came to being listened to, being involved in decisions about their care, and their needs being addressed or making plans to do so. So the journey to a diagnosis. 58% of people shared they were diagnosed correctly first time. However, for 46%, it took over 18 months to get a diagnosis, and it appeared particularly common for conditions such as fibromyalgia, ME, chronic pain, to present to their GP practice multiple times over weeks, months, and if not years to try and get a diagnosis. And common themes were patients not being listened to, symptoms being dismissed or underestimated, and for some conditions, again, like fibromyalgia and ME, professionals not believing that they exist. There appeared to be a general lack of understanding of neurological conditions, both in terms of the symptoms and their impact on daily life, and also empathy. As a result of many of these issues, some sought private diagnosis. However, this is obviously a very kind of difficult decision people have to make and not possible for everyone. And a lack of timely diagnosis and lack of access to needed care had serious consequences. Some people share that they missed school, whilst others had to give up their jobs. This is a quote from a girl who has ME, and she shared kind of the impact not being listened to and having unmanaged symptoms had on her daily life. She presented multiple times to her GP and her hospital, and her GP said that people who say they have ME are just talking about themselves. We could all say we have ME. It's exactly what it is. It's all about ME. She then goes on to explain how this has stuck with her as an adult, and it led her to question whether her symptoms were real or if they were just all in her head. Her symptoms deteriorated and got so bad to the point that she was bedridden, but even then she was not taken seriously. She was referred to a neurologist, but even they didn't recognise ME as a serious condition. These two quotes are from two people who shared their experience of being diagnosed with fibromyalgia. And the first quote discusses how they had to take kind of information about their symptoms and the condition to the doctor to show how their symptoms matched. And not getting the proper care meant that they were left having to walk with a walking stick and giving up their job. And the second quote kind of discusses how not getting any sympathy and a poor understanding of the conditions impacted their life. They were told they needed to change their job and rest more, but it was not an option for them as they had a young family and a partner who worked shifts. So waiting times. We asked people if they were waiting for any additional tests or treatments relating to their diagnosis, and just over a quarter were. And this was often waiting for neurology appointments or access to pain management specialists. However, again, regardless of what people were waiting for in terms of kind of the test or the treatment or the condition they had, people shared that they were often waiting for months with little communication in the meantime. People were unsure of whether they were still on waiting lists and were unsure how to manage their symptoms in the meantime. And this was despite some reaching out for support as well. So treatment and condition management. This focuses more on kind of management outside of medication. So just under half had been offered or received treatment other than medication. However, there appeared to be a real inconsistency in who was offered support. And this wasn't in terms of, say, that everybody who lived in the east wasn't offered support, but everybody in the north was. It appeared to be much more random than that. So, for example, some people with chronic fatigue were referred to the CFS service, but others were not. And we were kind of unsure why that was the case. For those who were referred to pain management support, it was often found unhelpful, just telling people what they'd already researched online. We asked people if they felt there was any treatment or support they would benefit from, and after reviewing all the responses, it became very clear that people were unaware of what support is available and what could be beneficial. So, medication. Just under 3/4 took medication for their condition, and a similar number of these individuals had faced challenges getting medications that worked for them. And these challenges most commonly included side effects, particularly for pain management, the kind of horrible side effects of fatigue and nausea. Also, people often found that medications initially worked, but then as they'd been on them for a while, they didn't, so they had to change their dosages and change medications, and tapering off pain medications often had some really pretty horrific side effects. And also, for those with epilepsy, their medications and dosages couldn't be changed without seeing a specialist. However, there were often long waiting times to see a specialist. So, what works well? For those who were able to access specialist care, such as that from multiple sclerosis nurses and the CFS service, it was praised, and MS nurses especially were praised for being very responsive and supportive. However, unfortunately, not everyone was able to access such care. So, what could be improved? Many of the improvements suggested by respondents again reiterated the findings and recommendations from the 2018 work, and the main was listening to people and taking them seriously. And then again, improving knowledge of neurological conditions amongst healthcare professionals. There was a call to establish better local support, whether that be local specialist clinics and hubs, and peer support. People found peer support helpful, and you could get a shared understanding with people and share tips and tricks, but of course this was no replacement for support from a specialist. Again, there were calls for better pain management and access to pain clinics, and because people are often under the care of many different parties and even out of county, it was highlighted that there needed to be better coordinated care. Also, no two people, say with chronic fatigue syndrome or fibromyalgia or MS or any condition, are the same, and people felt that then this needed to be recognised more and that people's lives will be impacted differently, so they each need different support. So one healthcare professional shared their view. They worked in the community sector to support those with neurological conditions, and they too highlighted that the biggest challenge is often a lack of knowledge of the conditions and a lack of services in Lincolnshire to support those with neurological conditions, and that this is what needs to be improved in the future. So, what's next for this project? We have produced a draft report and shared an overview of the findings with you today. After this, we will be sharing the report with all relevant health and care bodies in Lincolnshire, including public health, the voluntary and community sector, and offer them chance to reflect and comment on the findings today, and to share initiatives that they have implemented to support those with neurological conditions. These comments will be added to the final report before it is published. And this is just a demographic breakdown, so of who we heard from. And we'd just like to say that we recognise that the experiences shared through this work may not be fully representative of all those who have accessed care for neurological conditions in Lincolnshire. However, a real strength of the data is that lots of people were raising the same issues. And again, the findings reiterated those from our survey in 2022 and the work of the University in Lincoln in 2018. So that's everything from me. Thank you for listening, and I'll pass back to Dean. Thanks.